Hi everyone, this is Dr. Nitin Chhoda with Ignition Time, and in this video I want to help my viewers and subscribers who have lost health insurance. According to a recent news report, millions of individuals have lost health insurance as a direct result of this pandemic. In fact, up to 12 million Americans may have lost their employer-sponsored health insurance, again, as a direct result of the pandemic because you lost your job or because you got furloughed. In this video, I'm going to give you some information and go over some of your options. I will also provide you with a link in the description section to an article which will provide you with additional resources on how you can go out there and get your health insurance if you don't have health insurance. Now, if you already have health insurance, my advice to you would be to share this video with someone who has lost health insurance or is about to lose health insurance so you can help them. So with that being said, let's get started. Right now, we have historically high levels of unemployment. As many as 12 million Americans have lost their health insurance since the start of the year, according to a study by the Economic Policy Institute. In fact, I'll show you the study right here. This is a PDF file from the Economic Policy Institute, and the headline reads, Health Insurance and the Pandemic Related Shock, what we know so far about health insurance losses and what it means for policy. But I'll give you the bottom line in this article. Basically, what's happening is a lot of individuals rely on their employer across the country for health insurance. That's just the way things are. So the shock of the pandemic has cost millions of individuals their ability to have health insurance because this is a public health emergency. This is basically a catastrophe for many people. Now, many people who've been laid off are already in a very fragile state because you have no income coming in, and on top of that you lose your health insurance and you can't afford to buy health insurance because it is so expensive. So trying to get reinsured can be very challenging, very overwhelming, which again is why I want to give you some information in this article. Remember, you, as far as possible, you do not want to become uninsured, because if you become uninsured and you fall sick and you need and you don't have insurance, the bills could be significant. So the first thing you want to do is, if you can, talk to somebody in your company's human resource department, and you can understand when your coverage technically ends. So if you have the opportunity to speak with someone in your company's human resource department, you want to find out when the coverage technically ends. There is no real rule because it varies from one company to another. And if you've been laid off, it's possible that your coverage ended the day you were laid off. It's quite possible that your coverage may be continued for a few weeks after you were laid off. It really depends on your company. So you do want to speak with your company, but you need to start doing the research so you can, if necessary, transition to a new plan. Now, if you've been furloughed instead of being laid off, if you've been furloughed, there's a chance that your coverage could continue. Again, you do need to speak with your company, and if your employer does indeed allow you to stay on the group plan while you're not working, you need to clarify with your employer how they are handling the employee contribution, because typically when you're working with a company, and again this varies from one company to another, you contribute a certain portion, the employer contributes a certain portion. So let's say your health insurance costs $800 a month for a single person, or $1,200 a month for a family. Let's say you contribute $500 a month. That's taken out of your paychecks, and the remaining comes out of the remaining is something the employer covers as part of your benefits. You need to clarify with your employer, if you have been furloughed, what your portion is, what your portion of the contribution is, and that's very important. In fact, let's take a look at this chart on your screen here. This shows you the employer-sponsored health insurance coverage throughout the country. So you can see this chart. If the darker sections correspond to a higher level of employer-sponsored coverage. So you can see some states like New Hampshire, 57%, Wisconsin, 57%. Some states have a significant portion of employer-sponsored coverage, whereas other states have a very low portion of employer-sponsored coverage. Let's take a look at New Mexico, for example. That has 37%. In other words, that's still, 37% is still a significant amount of employer-sponsored coverage. The bottom line is a majority of individuals are dependent on employers for their health insurance, and these trends vary throughout the country, as you can see. Again, as you can see from this chart on your screen here. Again, the lighter sections correspond to states where the employer-sponsored health insurance coverage is less, and the darker portions correspond to states where the employer-sponsored health insurance coverage is more. So some companies have actually said that furloughed employees do not have to pay their premiums while they're out of work. I mean, that makes sense. If you're not getting a paycheck and you're furloughed, how are you going to pay your premium, right? So you don't have to pay your premium if you're furloughed. But let me be clear, it's quite likely that when you go back to work, or when you're called back to work, And for the sake of this particular discussion, let's just assume you're going to be called back to work, so I can make my point here. If you're called back to work, when you're called back to work, your company will most likely make you pay that portion, your portion, during the time that you were furloughed, because when you do get back to work, they'll say, hey, you know, you didn't pay your employee contribution for so long, but the health insurance company still had to get paid. We paid your portion on your behalf, because if they don't pay it, you lose coverage. So you see, the health insurance company, the payer, doesn't care where the money comes from. For them, they just need to get paid so your coverage doesn't lapse. So again, it's quite possible that your employer basically says, hey, you know, from April through September, you were furloughed, you did not contribute your portion, we paid our portion of your coverage and we paid your portion so that the policy would not lapse. But now that you're back, you owe us X thousands of dollars. So just make sure, you know, you keep that in mind, because I don't want my viewers and my subscribers to get a big shock when they come back. So just make sure you're aware of that. Also, navigating, you know, the health insurance landscape and trying to find coverage on your own can be extremely challenging, can be very daunting. Now keep in mind, if you do have a diagnosed condition like cancer, like lupus or diabetes, you may be able to get support when it comes to making a decision about a plan, when it comes to signing up for a plan with the National Patient Advocate Foundation. That's a National Patient Advocate Foundation, and we'll provide you with a link in the description section below, so you can get in touch with that foundation. You can also consult with what's called as a local healthcare navigator. Again, you'll be provided with the links in the description section below. Generally, if an individual is laid off or if they're uninsured, they have three options to get coverage. The first option is what's called as the COBRA plan. I'll give you that information in just a second. The second is the healthcare, the Affordable Care Act marketplace, which is a subsidized marketplace. It's basically where you go to the website and where you look for health insurance plans, and how much you pay for a health insurance plan through the healthcare marketplace, which is the Affordable Care Act subsidized marketplace, depends on your income. So if your income is low, the government will actually subsidize more of your health insurance. I mean, if you're living at or below the poverty line, the government can subsidize a significant portion, as much as 80-90% of your health insurance marketplace. You will have to contact the health insurance marketplace for specific eligibility requirements, okay? So you'll need to get in touch with them. Or you can also enroll in a program like Medicaid, or depending on your age, Medicare. So in some cases, you know, if your spouse is still working, let's say you're fortunate enough to have your spouse still employed at a place that does offer family coverage, you can request to join the group health plan. So that is another option, and you'll typically have to do this fairly quickly. So make sure you don't delay as you're watching this video. Now, what is COBRA? COBRA is a Consolidated Omnibus Budget Reconciliation Act. See, I did it in one shot, I pronounced it. It allows individuals who work at companies with 20 or more employees, okay? So COBRA allows individuals who work at companies with 20 or more employees to pay to continue their workplace insurance plan for certain periods of time. So let's say your insurance plan cost $1,100 a month. You can continue the plan as long as you pay for it, the full amount, for a certain period of time. And you know, it can cost several $100s a month, because again, you're shouldering the cost of the entire plan. So most people do find that to be very, very expensive. But if you have an HSA account, a health savings account, you can dig into that money to pay for your COBRA plan, and that can have tax advantages for you if you have an HSA account and if you've set aside money for an HSA account. So if you don't know what an HSA account is, look it up on Google. And you know, I can't sort of discuss the HSA account within the framework of this video, but if you folks want, I can do a separate video on an HSA account. So so basically, if you stick with your, if you use the COBRA plan, then the advantage is you keep your current plan, you know, you stick with your current doctor, and that doesn't have to change. But again, you'll have to pay for it out of pocket with your own money. On your screen, you'll see a chart of individuals who are losing healthcare coverage as a direct result of this pandemic. This is a surprising chart. So this chart shows you job losses from the pandemic. You know, millions of individuals have lost their health insurance. This is the share of adults without healthcare coverage, and now you can see this in states across the country. New Hampshire, for instance, is 11%. Idaho is 18%, and some states have significant, you know, losses of individuals losing their health insurance coverage. Mississippi is at 22%. Florida is at 25%. Texas is at 29%. This is, you know, some of these statistics are unbelievable. So now keep in mind, you have 60 days from the loss of your job to sign up for COBRA, and the coverage will be retroactive from the time that you were laid off. or if if you're in between jobs, you could wait and see if you need care and only enroll in COBRA, if you really need to, because you do have 60 days. But if you do proceed with COBRA, you should have that money set aside, because it is going to get expensive, and you need to understand the exact enrollment steps involved with COBRA. Remember, this video is meant to give you a starting point, and I'll give you links in the description section below. This video again is meant to give you a foundation for what you can do. For most individuals, the Affordable Care Act marketplace might make the most sense. Depending on where you live, you can access the federal marketplace or your state marketplace, and if you lose your job, you'll qualify for what's called as a special enrollment period, which is 60 days. So you need to keep that in mind. Also, many plans on the Affordable Care Act marketplace can get expensive, especially if you're unemployed, and the subsidies, like I said earlier, are based on annual income. So if you did depending on income levels, you get a subsidy. Just keep in mind though that any unemployment benefits that you're receiving, this is important, any unemployment benefits you're receiving count as income. So when you're on the Affordable Care Act marketplace and they say, what's your income? And you're getting, I don't know, I'm just going to throw out a number, $3,000 a month with, some unemployment benefits or something else you're doing, whatever. This $3,000 a month is just a number, you put in $3,000 a month, that's considered your income, and that'll then determine whether you get a federal subsidy and how much of a federal subsidy you get. So keep that in mind. You need to fundamentally ask yourself, what is the maximum you can spend per month on insurance? Do you have any predictable healthcare expenses like regular medication or regular tests that you need to take? You then need to evaluate how much a given plan is going to cost you, not just the premium but also the co-pays, deductibles and co-insurance expenses. So we will provide you with a link to a calculator below from the National Patient Advocate Foundation, which will help you determine what your costs will be on the Affordable Care Act marketplace. So now keep in mind, if you do have certain doctors that you want to see, that you want to continue to see, then you'll need to check with your plan as to whether those doctors are in network with that plan. And if the doctor is not in network, you'll have to ask your doctor to see if they'll get in network with that plan. So whenever you change healthcare coverage, there is a possibility that you may need to change doctors. Now there is another option of switching to Medicaid. Let me show you a chart on your screen which shows you the expansion of Medicaid after the Affordable Care Act. So remember, the Affordable Care Act facilitated the expansion of Medicaid, and all the states in blue adopted Medicaid, rather expanded Medicaid under the Affordable Care Act. So if you live in one of the states in blue, Medicaid was expanded, and Medicaid essentially provides coverage options. It's one coverage option for individuals who find it, who can't qualify for or cannot afford other options like the Affordable Care Act or COBRA, or don't have employer-sponsored coverage. So Medicaid is indeed an option. Medicaid does have zero premiums in most states. So Medicaid can be the preferred option, if you can't afford other plans. Medicaid eligibility is based on monthly income. This is important. So even if you've got a sudden decline in income, you could become eligible for Medicaid in those months. So that's something important to keep in mind. You could sign up for Medicare if you're on your employer's plan and if you're over the age of 65. So there is that option, and you need to keep in mind that there are other plans like short-term health insurance plans and some different independent plans out there, but they're not regulated by the Affordable Care Act. So you may have other hidden expenses over there. But the bottom line is, you don't want to wait until you're employed again to have health insurance coverage. Try not to have a lapse in your health insurance coverage. You can always cancel your plan. You can always get a plan and cancel it at any time. The problem, of course, is we don't know when we're going to get a job again. The purpose of this video for my viewers and subscribers was to make sure that as you look for a new job, or as you try and re-engineer your skills, to prepare yourself for the future, I'm hoping that most of my viewers, most of my subscribers can have coverage. That's what this video is all about. Having insurance coverage is very, very important. So please do your best to have coverage. And here, let me switch my glasses. I've been switching glasses lately. But having coverage is very important, and I do want my viewers and my subscribers to have health insurance coverage. And hopefully this video gave you a good starting point about what you can do next. My name is Dr. Nitin Chhoda. Thank you so much for watching. I really appreciate you. If you don't know anything about me, check out my introductory video. I have the honor, the privilege, the fortune of living the American dream. I am a beneficiary of the greatness of the United States of America, and I want to help you achieve that same level of greatness, and I will help you achieve that with my channel. If you learn something new, please click like, please click subscribe, please enable notifications so you get instant updates going forward. Remember, on our channel we release videos at 2 p.m. East Coast time most days of the week, so make sure you're subscribed to our channel to get instant notifications. Now these days YouTube hasn't really been sending out notifications as soon as I release the videos, which is fine. I mean, the videos are still online for you to watch at any time. You may want to bookmark the channel in your browser, youtube.com/ignition time, so that you can just check out the YouTube channel a couple of times a day and see whatever new videos I've released and watch them immediately as soon as they come out, because I don't want you to miss a video if it's going to be beneficial for you. I appreciate you watching. Also, if you want to get on our SMS list and email list, send a text message with the word ignition or with the word time to 70,000. That's 70000, and this way you'll get added to our SMS list and you'll get instant alerts from us going forward. You can also get added to our email list and you can opt out at any time. Once again, this is Dr. Nitin Chhoda with Ignition Time. Thank you so much for watching. I'm looking forward to seeing you in the next video of Ignition Time. Take care. Bye.